Good morning, all of you. Here I am to make the lectures, oral pathology lectures, far more easy and precise for you. So here I'm going to discuss the odontogenic cyst, and basically first topic is the classification of the cyst, which is the most asked question in the exams and in the vivas of the UG dental students. So, the classification of the cyst is basically based on the etiology here, based on the tissue of origin, and the rest are which are unclassified, they are also mentioned. So now based on the etiology means what is the cause of the development of the cyst, basically why the cyst is developing. The two major causes, which are firstly the unknown cause, basically the developmental origin, that means that it is developing without any reason, that is unknown origin. Now the second is the inflammatory origin, that is inflammatory cysts. This is because of the inflammatory mediators and the products of the inflammation which are causing the development of the cysts, like in case of the perireticular or the periapical cyst. This is because of the development of the dental caries, the sequelae basically, and the products of the inflammation which cause the development of the cyst, basically the outer part of the cyst enlarges, and the inside of the basically the cyst, it degenerates, which leads to the formation of the cyst, that is because of the mediators. So here we are going to discuss firstly about the developmental cyst which are of unknown origin, that is the dentigerous cyst. The dentigerous cyst, it is basically the most common developmental cyst and the most common odontogenic cyst, which also we can see in the clinical, which we can see in our clinical practice, is the radicular cyst, which basically is the most common odontogenics, and the most common developmental cyst is the dentigerous cyst. Next one is the eruption cyst, which basically we can see in the newborns, that is of bluish, whitish, or somewhat of bluish and whitish color, which we can see. Then the odontogenic keratocyst, which is the most aggressive and has the high chance of recurrence if not removed properly. So it is an aggressive odontogenic cyst. And the next one is the gingival cyst of newborn, then the gingival cyst of adult, then lateral periodontal cyst, which is also known as a botryoid odontogenic cyst, because of the basically the pattern. The pattern means like the bunch of the gray pattern, which is which we can see, and hence the name is given as the botryoid odontogenic cyst. And the calcifying odontogenic cyst, that is the Golden cyst. Glandular odontogenic cyst, also known as the sallow odontogenic cyst, which means sallow means the gland, the salivary glands from which it takes origin, and the mucoepidermoid odontogenic cyst. The second classification, that is because of the inflammation and the inflammatory mediators. The cause is basically the inflammation, like if dental caries occur, then pulpitis occurs, then apical periodontitis occurs. So the sequelae will give rise to the cyst because of the mediators of inflammation, which leads to the degeneration or the degeneration of the inside of the cells, and the outer part, it keeps on growing, which leads to the formation of the cyst. Then residual cyst, which is basically the remnant of the remnant. If the periapical cyst is not removed properly, then the remnants which remains give rise to the residual cyst. And the last one is the periodontal cyst. On the tissue of origin, here based on the tissue of origin means the cyst which is forming due to various etiologies. Like earlier we studied about the developmental cyst, the inflammatory cyst. So now what are the cells which are giving rise to the cyst, means basically what are the cells. So firstly we are discussing about the derived from the rest of the malaise. The rest of the malaise is basically the term which is given to the remnants of the periodontal ligament cells which remain there at the site. And periodontal ligament means surrounding the root of the tooth, they are present, so they give rise to the periapical cyst and the residual cyst, which is obvious, means the name is only describing the cysts. That is, if when they are present in the periodontal ligaments, then they will give rise to periapical and residual kind of the cysts. Now derived from the rest of the serrae. Cell rest of the serrae is basically they are the remnants of the dental lamina. The dental lamina means from from where the tooth bud takes its origin. So basically they are the odontogenic keratocyst, the gingival cyst of newborn, gingival cyst of adults, then lateral periodontal cyst, and the glandular cyst. They are basically arising from the dental lamina cells. Now derived from the reduced enamel epithelium. Reduced enamel epithelium, it basically is a membrane which covers the crown of the tooth, the crown portion of the tooth. ठीक है. So when the crown gets the tooth bud is it matures, it's formed, and the tooth is formed. So when it arises into the oral cavity, then the layer which is covering the this the enamel, it gets disintegrated, or it gets disappeared. So if when it is present in the basically inside the mandible, the tooth bud is present, then it is covered with the reduced enamel epithelium, and this enamel epithelium which is surrounding the crown, it gives rise to the dentigerous cyst. And the next one is the eruption cyst. Now the last one is basically the unclassified cysts. That is, they are basically the periodontal cyst and the calcifying odontogenic cyst. So here is basically a mnemonic which I'm going to tell you to memorize uh, these cysts in a better way. Basically DOGG and LCM. Here the mnemonic I have, I made this mnemonic. Maybe all of you may, most of you may have better mnemonics. You can always comment below this video for better mnemonics. Here when I studied my UG, I used this mnemonic only to memorize it. So the mnemonic is DEOGG, dog basically. So you can add E also in between. So D, if you want to learn, memorize it in sequence. So from the most common, this is dentigerous cyst, then the eruption, then OKC, then gingival cyst of adults, gingival cyst of newborn, then LCM, that is of the mathematics. So you can you can remember by the mnemonic LCM, that is lateral periodontal cyst, calcifying odontogenic cyst, and the mucoepidermoid cyst, this cyst. So basically, and this, so you can remember that based on the inflammatory origin. So this is basically very easy to memorize, that inflammatory origin, that when we have inflammation, then when we have inflammation, then these cysts they appear, like periapical cyst, residual cyst, and the periodontal cyst. Easy for those who are reading it for the first time, and they are facing difficulties in memorizing the cysts and everything. So I just made it a little bit precise. So now and easy. So now the derived from the reduced enamel epithelium, we have what is known as the dentigerous cyst and the eruption cyst, that is DE, the first two DE. Then OGG, that is this serrae, and rest the malices which are periodontal. You can memorize it that when something is present periodontally means it is related to periapical cyst, and the which are remaining apart from the two is classified as paradental, and the rest is the calcified odontogenic cyst is classified as uncalcified. I hope all of you like the video, and it's my first video, and I hope it is helpful to all of you. Please do like it and comment in case I did some mistakes or something. Then you can always comment, and thank you so much. All the best.